Hi, this is Cancer 101, and today we're going to be talking about the common phrase, signs and symptoms, which you've probably heard before. As you can see, today I'm using the universal symbol of the coronavirus, the face mask, to cover up part of my paper. We're going to be talking about signs and symptoms. You might think, well, why do they have to say signs and symptoms? Why don't they just say symptoms? Seems a bit odd, seems like an archaic phrase, but there's actually an important difference between signs and symptoms, so let's talk about that. Symptoms first. So symptoms are something that a patient reports to the doctor, and I'll talk about that word report in just a second. They may be things like pain or numbness or fatigue. So you might say, doctor, I'm just feeling so tired all the time after the chemotherapy treatments, or I'm feeling pain in my chest, or I'm feeling numbness in my lower extremities. That in symptoms, the patient is simply reporting to the doctor, and the doctor has no way of verifying it. He can't measure your pain or your numbness or your fatigue. And so in the medical report, the doctor will actually write something like, patient reports pain on the left side of the chest. Patient reports numbness in the left toes on the left and right side, and things like that. And it's not that the doctor's doubting you, but they want to be absolutely clear that they're simply reporting what you said, and they haven't been able to independently verify it. One particular reason for this, a glaring example, is that many patients could be drug addicts and they're simply seeking drug medicine, and they come into the ER or whatever and they report pain, and they ask for some kind of strong pain medication. And there's no way that the doctor can actually say for sure that they're in pain. And so they're always careful about that. And then we can talk about signs. So signs are medical evidence of disease or your medical condition that the doctor can actually verify. For instance, swelling. You have a twisted ankle and your ankle's swelling up. Well, the doctor can easily see that. You have a skin rash on your arm. Easy to see. Pulse rate. Easy to measure. Or maybe there are high contrast nodules on a CT scan. Now, that doesn't necessarily mean they're cancer, but it means we can see them and we have to find out what they are. So that's the difference between signs and symptoms. I hope you found it useful.